This is the Now Morning Show, and I'm always happy when Dr. Erica Wheeler joins us on set. I think she's been on set like this is your third time in a week and a half.
Yes.
And I think I just love it when you come because you have so much information. And at the end of the interview, we feel as if we know a little bit more about this whole situation and have a little more comfort. So yesterday, the Prime Minister outlined the measures for the next couple weeks. And what I observed is that, you know, and you hear the conversation about flattening the curve and so on, and creating a sterile environment. What I noticed is that Trinidad and Tobago seems to be, and many people are saying that we seem to be at least one step ahead of countries like Italy and so, where there was this explosion. And you had spoken about the various protocols previously in an interview that the WHO helps the sovereign governments with in terms of putting things in place should there be a pandemic. So is Trinidad and Tobago ahead of the curve now, would you say, based on what we have put in place?
Well, first, let me start by saying it is my pleasure to be back as well,
Yes.
to be with you. And in terms of flattening the curve and us being ahead, I think for Trinidad and Tobago, we have observed what's happened in China. So we are learning the lessons from other countries.
Mm-hmm.
We've observed what happened in Italy. And the number of cases in the community, we call it community spread, as opposed to those persons only bringing it in.
Mm-hmm.
Once you have community spread, it is very difficult to control the virus. So the steps that Trinidad and Tobago is taking is because we've learned from other countries very wisely.
Right.
And so therefore, the measures, as the Prime Minister said, they might be inconvenient, but they are necessary in order for us to ensure we are a small country, that we remain as safe as possible, which includes, of course, closing borders, which again, China did very early on. Once they realized the epidemic was becoming out of control, they locked down Hubei province and the city. Italy didn't do that right away, so we have learned the lessons from other places. So we are putting them into action, as it was in Trinidad and Tobago. So when we talk about flattening the curve, that really means that instead of waiting until we have widespread community transmission, and right now our cases are imported, so we want to prevent as far as possible community transmission. So therefore, flattening the curve means that when you reduce movement, you restrict the number of people gathered in any one place, you emphasize the personal hygiene, the environmental hygiene. All of those things mean that the likelihood of community transmission is reduced, so you don't have those peaks that you saw. So the number of cases, instead of going up very sharply before they drop, there are lesser cases.
Right.
So that's what's meant by flattening the
Because
curve.
of course, when they go up very sharply, it puts pressure on the health systems.
Absolutely. And although there is preparation in Trinidad and Tobago, we don't want to be careless with the citizens of Trinidad and Tobago. I mean, we as PAHO as well, of course, as the government. So therefore, the measures that are put in place are necessary. They may not be convenient, but they are to protect the population.
Some countries have chosen to close their borders completely. No one can leave, no one can come. We have a partial closure, so non-nationals are not allowed in the country. How does that affect the whole situation, whether you close it partially or completely?
Well, there has only been a little research done so far in Italy that shows quite accurately the number of persons who are allowed to move about outside of their home environment, outside of their state. Actually, the reduction in the numbers of people moving around actually does begin to slow down the spread of the disease. So the issue of us, we are island states, people coming in and people leaving. Remember, all our cases so far are imported cases. So it is on the basis of that, I believe, that the government is taking those measures, because it is people coming from outside or people transiting through Trinidad and Tobago, as we saw in the case of Jamaica and the person who went to Guyana. So this means persons bringing COVID-19 into the country. So therefore, the wise thing to do would be to address those persons coming in. Of course, you can't stop non-nationals from coming home. That is
Right.
inevitable.
Yes.
But when they do come home now, they have to self-quarantine. And self-quarantine literally means that you are in your own environment, either on your own, or if you're with your family, you are in a room by yourself. You use separate cups and saucers and plates. You go to the bathroom last. You keep the social distance, the 3 feet away, the 1 meter. So take all of these measures. You do not go out.
Right.
You stay in your house. It literally means
I'm glad
that.
you raised that, because I was driving through the streets yesterday and saw children riding bikes, in the road and so on, because obviously the children are at home. That is not what is meant to happen, is it?
No, well, it depends on whether you are at risk or not. If you are not at risk, then it means unless you come into someone in the community, and we don't have community transmission yet,
Okay.
unless you come into contact with someone in the community, you don't stand the risk of picking it up. Now, what I will not know, and what you may not know, is whether those children were part of families that were meant to be indoors. We don't know that. But COVID-19 is not an airborne disease. It is not something that goes through the air. You have to transmit it to someone by coughing or sneezing on them.
Right.
So it's the congregation of large numbers of people and the prevention of the spread that way through large numbers of people in any one place. I believe the government has put a limit of 25
Yes.
persons. So that is what it is. I don't believe that it is random in the case of children riding their bikes in public, but it really depends on whether those children are part of
So
families.
it's okay
who
to
are
let the
in-
children go outside and, ride in the streets and so on for now.
For now. For
Okay.
now. We don't have evidence yet of community transmission. If, God forbid, that happens, then again, I am sure the government will make adjustments to the rules of the movement of people in public.
Okay. Let's talk about the workplace now. So some
Yes.
people still have to go to work.
Yes.
How can the companies make it safe for the employers themselves and the employees?
Okay, so of course, yes, people still have to go to work. My office is still open, for example. So employers have a responsibility to their employees on different levels. Of course, to make sure that their environment is clean, so they need to step up
Yes.
the cleanliness of the environment. So the cleaners, the contractors, people who come in, if you come from outside, of course, you have to do all the hand sanitizing. But it is advisable for the cleaners in the office that they be told, they be brought together and given instructions as to how to clean better, how to be more meticulous in keeping the environment clean. We know that if you don't have commercial cleaners, 5 tablespoons of bleach in a gallon of water does the trick.
Right.
In terms of also keeping the environment clean, when persons cough or sneeze, and of course every cough or sneeze, as Dr. Trotman says, is not COVID-19,
Yes.
but the tissue should be thrown away in a closed bin.
So these open bins that you see in washrooms, that's not where you need to
No,
be.
you need to have closed bins. So
Right.
employers need to make that available.
Right.
Of course, they need to have all the, in addition to the freestanding hand sanitizers, they should have dispensers and make sure they are placed in all the appropriate places in the workplace. And that
As we have here at TTT, for example, as you come in. Yes.
Exactly.
Yeah.
But persons also be told.
Yes.
You have to tell people where
Yes.
they are
Yes.
and make sure that they use them.
Yes. So,
and-
for example, we have the sign up, and we also have with the guests someone to greet and say, please use the hand sanitizer. Yes.
Exactly. You can have posters in different places in your workplace about personal hygiene, about washing your hands frequently and when you should wash your hands.
Right.
Put them in the bathrooms, put them in the kitchens, in the workplaces, all the obvious places. The next thing that employers really should do is they should look at their personnel policies.
Right.
And make sure that there is flexible provision for those persons who may not be feeling well. We are discouraging people in general, of course, if you are not well, to come to work, because even when you have the flu, you don't tell
You
people
shouldn't really come
you
to
should
work.
not
Yes.
come to work. But should persons suspect that they have COVID-19, of course, they need to stay at home and call their doctor, go through the whole protocol, calling their doctor, or very soon there will be a hotline available. The other thing that employers should do is to ensure that there are facilities for persons to work from home if necessary.
Yes.
So those persons who can't come into work for one reason or another, they should ensure they have a computer or whatever is necessary for their working. If they have branches in the community, those persons in charge of those branches should be given the authority to make decisions based on company policy.
Yes.
Company policy should not be punitive. It should be flexible. It does not mean that people can just stay home when and if they can, because there are rules about how many days you can stay home without a certificate from the doctor.
Right.
But in general, there should not be punitive policies. The other things employers should do is to ensure that under their occupational health and safety rules, there are persons that employees can speak to should they be stressed, worried, concerned. So, because we tend to overlook mental health
Yes.
as an issue in the workplace, as in schools.
Yeah.
But the employers should put those things in place. And of course, on the part of employees now, just like you here, showing that very good example, be responsible.
Yes.
Do all the things that you know you should do to keep your environment clean, keep yourself, the personal hygiene, observe it, inform your supervisor if you are not feeling well, and of course, do the right thing in terms of contacting your doctor, your clinic. Don't rush out to the emergency
Yes.
department.
To put more burden on the health
Exactly.
system.
Don't jump in a bus or maxi taxi to go to the clinic. Call, they will come to you. The government has a protocol in place. So it is about us all of society being responsible, because the government can't do it on their own and we can't do it on their own. So it has to be a all of society approach, but also making provision for flexibility in the
Yes.
workplace.
Yeah,
for
I can't
employers.
stress the fact that it's really the time for us to be responsible, especially as the media, in terms of what we communicate, the type of information we communicate. I think it's very relevant now that we take the steps to provide information for clarity and for inspiration, as opposed to sensationalization of the issue, and also the spreading of fake news and spreading of news that cannot be verified. So I encourage you to stay with us on the morning show, because from now until at least for the next 2 weeks or so, every day we'll be providing you with relevant, current, and accurate information from the experts themselves, like Dr. Wheeler. Dr. Wheeler, you know you're going to be back here next week, most likely, because as the whole COVID-19 situation continues, we want to make sure that people have the accurate information from the source, from the experts, and who better than Dr. Wheeler from the WHO and PAHO representative for Trinidad and Tobago and the Dutch Caribbean Islands.
Thank you so much, Lisa.
Thank you so much for coming with us this morning. I'll see you next week. All right, we're going to take in a few messages. Shamla, it's unique, not different. Shamla has 2 interviews today, one with the Minister of Health, actually, so stay tuned for this.